My name is Nicole Mannion. I'm an occupational therapist here at Boston Medical Center. I've been working here for 6 years, and I've worked rotated to the trauma service for probably 2 to 3 rotations. I've spent at least close to 2 to 3 of my 6 years working with trauma patients.
My name is James Mergel. I'm a physical therapist. I've been working at Boston Medical Center for almost 12 years, and I too have been on the trauma service and the floors that treat the patients with trauma for probably close to 2 or 3 of those years as part of the rotations here at the hospital.
Part of what we do for occupational therapy specifically is we work with, actually end up seeing most of the trauma patients, probably near like 90 to 100% of them, and we do evaluation, treatment, discharge planning, and specifically what we work on with these patients is trying to get them back to their pre-morbid level of functioning and get back to their roles that they're used to doing before they were injured. So some of the ways that we do that is if someone has an upper extremity injury, we can work on increasing range of motion, increasing strength. If they have an injury that requires special bracing or splinting, we can make them custom splints, custom braces. Sometimes they just need prefabricated braces or splints, and we can do that with them as well. We kind of do all of this in the lens of getting them back to their functional status. We also do a lot with psychosocial and cognitive dysfunction. So if someone were to come in with a trauma and let's say they had a brain injury, we would work with them to rehabilitate their cognitive functioning. We also work with family members and training them on how to help the patient get back to how they were doing before. And also some discharge planning as well. So what is the patient going to need from here? Are they going to be able to just go straight home? They're going to need outpatient therapy, inpatient, and we work with them to provide the highest level of care.
From physical therapy, we work on a lot of the similar things initially. Unfortunately, these patients have a lot of needs and they're very impaired because of the trauma, so we help them a lot with, could be very basic tasks, whether it's just sitting up on the side of the bed, attempting to get out of bed, and really just getting as mobile as possible. Many of these patients do have like orthopedic trauma in addition to the head trauma and potential brain injuries that Nicole mentioned. So it can be a lot of gait training, learning to use new assistive devices. So it could be a crutch, walkers, wheelchairs, whatever the patient really needs just to start getting moving again and getting back on with their lives and getting out of that hospital bed. So that's really what we do.
Yeah.
I think one aspect of working with the patients with trauma and with the trauma service that's really rewarding is it's definitely a multidisciplinary approach. So a lot of times we'll work with the physicians from multiple teams, whether it's orthopedic, vascular surgery, neurology, neurological critical care, work with the nurses, the physician's assistants, the nurse practitioners, and many of the other services that help out these patients. So it's a very rewarding experience to be able to work together as a team, because these patients, they need so many things after what they've been through.
Yeah, I agree. I think that's what makes this program work so well. We have really good communication with the team, and they have so many needs. Obviously the physical needs, medical needs, but most of them, are kind of in like a state of shock when they come in. So me personally, that's the part I really like the best, is just trying to make that connection with the patient, trying to help them out of the really hard psychological part of it too, and that's certainly something that we help with. And I think the fact that we work so well all together, all those different services, really helps the patients.
I think we provide a really helpful perspective, because a lot of the medical services are obviously working on getting the patient stabilized and fixing the broken bones and stopping the bleeding, and then we can hopefully help give that perspective of how is this going to translate to function, and how can this help the patient do what they want to do, whether it's just getting up and getting on a commode for the first time sometimes is the biggest achievement in that patient's hospital stay. So to be there to help them do that and see the look on their face when they get to do something like that is really, really gratifying.
Yeah. I definitely agree. I think, those are the moments that make us want to come to work, is making the patients really happy, being able to achieve this one small functional step. Certainly, I know a lot of us who work here have pretty vivid memories of working with the marathon patients. But some of those were the hardest things we've had to do working here, but also the most rewarding. And actually, your off the cuff example was exactly one of the most rewarding things I've ever done, was working with a double amputee and helping her get onto a commode for the first time and be alone in a bathroom, and it made her so very happy to just be able to do that. So
Yeah. And I've had a patient who went through a horrendous accident, like at a workplace, and he had been bedbound and receiving multiple surgeries for months and months. And so even for him, just to be able to sit on the side of the bed and talk to his wife and be able to do that from that position, for him was a great achievement. So those experiences are really rewarding.
yeah. And I also work on a lot of standing hugs with patients' family members, so they can finally get into standing after being in the bed for a long time, and their family members there, and they can give them a hug for the first time in standing. So anyone who knows me knows that that's very much me. So
She's a hugger.